Brain-Heart Interconnectome will enable us to really transform patient care and the quality of life for Canadians, and also on a global scale. We bring together researchers from multiple disciplines who will work hand in hand with patient partners to really address those important questions, to study and understand how the brain and heart are interconnected, to prevent and treat these diseases early, so to prevent disease progression. So this, we believe, will really transform healthcare and make a major impact for patients.
We only recently realized that cognitive impairment and memory loss is a prominent feature in patients with heart failure, occurring 40% in these patients. Indeed, our cross-Canada survey of heart patients told us that their number one concern is mental health and cognitive impairment, and not their heart. They're worried about their brain. These are two of examples showing how intimately the brain and the heart interact in ways that we're only beginning to understand. We're now busy looking for the scientific evidence to help us to change not only the scientific understanding, but also the awareness of the connections between the brain and heart, so that we can actually diagnose these conditions properly and treat our patients.
So my role in the project is that I'm chairing Foundation 1, which is the Epidemiological and Prediction Modeling Foundation. So for this foundation, we are going to be really trying to explore the prevalence of these diseases, how common they are in the population, and particularly among different ethnic communities and other kinds of sociocultural factors. So we really don't have an appreciation of, first, what the prevalence of the conditions are, but how they differ amongst different kind of high-risk subgroups. I'm also in charge of establishing what's called the Collaborative Data Portal. This is going to be a world-class leading collaborative data platform for the use of analytic tools and the combination of all of these data sets. So we can really leverage the power of the data to answer some of these questions.
I am co-lead of what is called Foundation 2 as part of the Brain-Heart Interconnectome. And Foundation 2 has the broad task of trying to understand the mechanisms that underlie the brain-heart diseases. So we're going to look really at the cellular and molecular ways that brain-heart diseases co-occur, as well as therapies and things that might actually improve them. That's going to integrate with data science and biomarkers and diagnostics, as well as things like therapeutics and approaches that all of our other partners as part of the grant are coming together. But ultimately, we're there to ask the fundamental questions of why and how these brain-heart conditions and diseases, how they occur and why they occur, so we can prevent them.